Section 17 of Aids to Forensic Medicine and Toxicology. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Jeannie Whitfield. Aids to Forensic Medicine and Toxicology by W. G. Aitchison Robertson. Section 17. Antipyrine to hydrocyanic. Chapter 37. Antipyrine, antifebrin, phenacetin, and aniline. Many of the synthetic coal tar products now so largely employed as analgesics are powerful toxic agents. Phenazone, antipyrine, or analgesin, is a complex benzene derivative prepared from aniline, acetoacetic ether, and methyl iodide. It is in colorless, inodorous, scaly crystals, which have a bitter taste. It is soluble in its own weight of water. Tests can be extracted from an aniline solution of chloroform. The residue left on the evaporation of chloroform should be employed for testing. If heated with strong nitric acid and allowed to cool, a purple color is produced. Ferric chloride gives a blood-red coloration, destroyed by the addition of mineral acids. Treatment: stimulants freely, inhalation of oxygen, patient to be kept in the recumbent position. Acetonilide, antifebrin, phenylacetamide, a constituent of daisy or headache powders, is obtained by the interaction of acetic acid and aniline. It is in colorless, inodorous laminar crystals, which have a slight pungent taste. It is insoluble in water. Test: may be extracted from acid solutions by ether or chloroform. If heated with solution of potassium hydroxide, odor of aniline is given off. If liquid, when it is warmed with a few drops of chloroform, a penetrating and unpleasant odor of isocyanide. Treatment: emetics, stimulants, inhalation of ether, recumbent position. Phenacetin, phenacetinum, is produced by the interaction of glacial acetic acid and paraphenacetin. It is in white, tasteless, inodorous, glistening, scaly crystals, insoluble in water. Of all the members of the group, it most rarely produces toxic symptoms. Treatment: as for the other members of this group. Exalgin, aspirin, etc., as well as above, may all act as poisons to certain persons, and even small medicinal doses may cause serious and even fatal consequences. Symptoms: more or less common to all: nausea, vomiting, hurried respiration, marked cyanosis, syncope. Persistent sneezing, widespread urticaria may be present. Collapse. Aniline is an oily liquid, heavier than and not soluble in water. It is colorless or reddish-brown. It has a peculiar tar-like odor. It is soluble in alcohol and forms a soluble sulfate with sulfuric acid. A solution of bleaching powder gives, with the solution of sulfate, a purple color, changing to red-brown. Symptoms: nausea, vomiting, giddiness, intoxication, drowsiness, gasping for breath, feeble pulse, and marked cyanosis. In its industrial use it may act as a poison either by inhalation of the fumes or by absorption through the skin. The symptoms, then, are mainly those of peripheral neuritis with blindness. Fatal dose: about 6 drachms. Treatment: wash out stomach, stimulants, artificial respiration, inhalation of oxygen, transfusion. Nitrobenzol, artificial oil of bitter almonds. It is used in perfumery, but is very poisonous when swallowed or inhaled, or absorbed through skin. It is used in the manufacture of aniline dyes, and may act as an industrial poison. The symptoms closely resemble those of aniline poisoning, but there is perhaps greater mental confusion. Fatal dose: 8 to 10 drops have caused death. Treatment: emetics, stimulants, transfusion of saline or blood, pituritin, strychnine, digitalin hypodermically. Nitroglycerin gives rise to intense and persistent headache, powder headache, throbbing and pulsation of all the arteries in the body, flushing of the face, and collapse may follow. Dinitrobenzene causes symptoms resembling nitrobenzol poisoning, and when acting as a chronic poison gives rise to weakness, jaundice, and peripheral neuritis. Chapter 38. Sulfonal, trianol, tetranol, veronal, paraldehyde. These are dangerous drugs. The ordinary symptoms of the group are noises in the ears, headache, vertigo, inability to stand or to walk properly, insensibility, and cyanosis. The most interesting point is the condition of the urine. In cases of poisoning it is dark or reddish-brown in color, due to the presence of hematophosphorins. It contains albumin and cast, but no red corpuscles. In cases of hematoporphyrinuria, the prognosis is bad, and it is said that these cases invariably end fatally. Treatment. In an ordinary case, emetics, strong coffee, hypodermic injections of strychnine, saline injections, and transfusion. Cases of chronic poisoning from the owls are not uncommon, and are increasing in frequency. Hypnogen is apparently identical with veronal. All the above named aniline derivatives are included in Part I of the scheduled poisons. Chapter 39. Conium and Calabara Bean. Conium maculatum, spotted hemlock. All parts of the plant are poisonous, often mistaken for parsley. Contains the poisonous principle cononine, a volatile liquid alkaloid with a mousy smell, insoluble in water, soluble in alcohol, ether, and chloroform. It also contains methylcononine. Symptoms: dryness of the throat, headache, dilated pupil, dysphagia, loss of muscular power, passing into complete paralysis, delirium, coma, and convulsions occasionally. Post-mortem appearances: congested brain and lungs, redness of the mucous membrane of the stomach. The stomach and intestines should be examined for fragments of the leaves and fruit, recognized by their microscopical appearance. Treatment: emetics, tannic acid or gallic acid, diffusible stimulants. Method of extraction from the stomach. Use Stas-Otto process. Tests: the mousy odour, deepened colour, and dense white fumes with nitric acid, pale red, deepening with hydrochloric acid. There are several umbelliferous plants which are poisonous. The water hemlock, Cicuta virosa, produces symptoms not unlike those of hemlock. It has been mistaken for parsnip and celery. It contains an active principle, cicutoxin, which in some respects is allied to strychnine and picrotoxin. The fool's parsley, or lesser hemlock, Aithusa synaptium, is another member of this group, although doubt has been expressed as to whether it is really poisonous. The water dropwort, Enanthe crocata, is undoubtedly poisonous, especially to cattle. In man it produces abdominal pain with diarrhea and vomiting, dilated pupils, slow pulse, and cyanosis, delirium, insensibility, and convulsions. The post-mortem appearances are not characteristic, but the stomach and intestines should be examined for portions of the plant. Calabar bean, or Physostigma. The bean of Physostigma venosum contains the alkaloid physostigmine, or arsine, with the antagonistic alkaloid calabarine. Symptoms: vomiting, giddiness, irregular cardiac action, contraction of the pupils, paralysis of lower extremities, and death from asphyxia. Treatment: emetics, hypodermic injection of 1/50 grain sulphate of atropine, repeated if necessary. Method of extraction from the stomach. Use Stas-Otto process. Test: the contraction of the pupil which it causes. Chapter 40. Tobacco and Lobelia. Tobacco. Nicotiana tabacum owes its poisonous properties to its alkaloid nicotine, a volatile, oily, amber-colored liquid, with an acrid taste and ethereal odour, soluble in water, alcohol, ether, and chloroform. The drug has an intense depressant action on the heart and respiratory centre. Symptoms: giddiness, faintness, nausea, and vomiting, with syncope, muscular tremors, stupor, stertorous breathing, and insensible pupil. Death has occurred after 17 or 18 pipes at a sitting. Post-mortem appearance: not uniform or characteristic. General relaxed condition of muscles, engorgement of cerebral and pulmonary vessels, congestion of gastric mucous membrane. Treatment: emetics, stimulants, hypodermic injection of 1/25 grain of strychnine, warmth to the surface by hot bottles, hot blankets. Method of extraction from the stomach. Digest the contents of the stomach in cold distilled water and very dilute sulphuric acid. Strain, filter, and press residue. Evaporate the filtrate to half its bulk. Digest with alcohol, and evaporate alcohol off in a water bath. Dissolve residue, sulphate of nicotine, in water, and make solution alkaline with potash. Then shake with ether in a test tube. Remove ether and allow it to slowly evaporate. Test resulting alkaloid. Tests: no change of colour with the mineral acids. White deposit with corrosive sublimate. Sulphuric acid and bichromate of potassium give a green colour. Oxide of chromium precipitate with bichloride of platinum and with carboxylic acid. Lobelia inflata, Indian tobacco. much used in America by the Coffenite practitioners, and a valuable remedy for asthma. Symptoms: nausea, vomiting, giddiness, cold sweats, prostration, headache, giddiness, tremors, insensibility, and convulsions. Chapter 41. Hydrocyanic acid. Prussic acid is the most active of poisons. The dilute hydrocyanic acid of the pharmacopoeia contains 2% of hydrocyanic acid. Shields 4%. It is a colorless liquid, feebly acid, with odor of bitter almonds. Cyanide of potassium is largely used in photography and in electroplating, and is also poisonous. It often contains undecomposed carbonate of potassium, which may act as a corrosive poison and cause erosion of the mucous membranes of the lips, mouth, and stomach. Oil of bitter almonds, used as a flavoring agent, may contain, when improperly prepared, from 5 to 15% of the anhydrous acid. Symptoms: the symptoms usually come on in a few seconds, and are of the shortest possible duration. There is a sudden gasp for breath, possibly a loud cry, and the patient drops down dead. If the fatal termination is prolonged for a few minutes, the symptoms are intense giddiness, pallor of the skin, dilation of the pupils, laboured and irregular breathing, small and frequent pulse, followed by insensibility. There may be convulsions or tetanic spasms, with evacuation of urine and feces. Death results from paralysis of the central nervous system, but artificial respiration is useless, as the drug promptly arrests the heart's action. It also kills the protoplasm of the red blood corpuscles, rendering them useless as oxygen carriers. Post-mortem appearances: skin livid, pale, or violet, with bright red patches on the dependent parts. The gastrointestinal mucous membrane is bright red in color, owing to the presence of cyanmethemoglobin. Hands clenched, nails blue, jaws fixed, froth about the mouth, eyes prominent and glistening, odor of acid from the body, venous system gorged. Treatment: empty the stomach by the tube at once, and wash it out with a solution of sodium thiosulfate. Strong ammonia to the nostrils. Stimulants freely: brandy, chloric ether, ammonia, sal volatile ad libitum. If a patient cannot swallow, inject hypodermically either brandy or ether. Hypodermic injection of 1/50th grain atropine. Douche to the face, alternately hot and cold. Death commonly occurs so rapidly that there is no time for treatment. Fatal dose (smallest): half a drachm of BP acid, equal to 0.6 grain of the anhydrous. Recovery from 1/2 ounce of BP acid. These records are fallacious, for in specimens the percentage of anhydrous acid varies enormously. Practically 1 grain of the anhydrous acid is fatal. Fatal period: from 2 to 5 minutes after a large dose, but may be less. Method of extraction from the stomach: having previously carefully fitted a watch glass to a wide-mouthed bottle, nearly fill the bottle with the contents of the stomach, blood, secretions, etc. Place a few drops of solution of nitrate of silver on the concave surface of the watch glass, and cover the mouth of the bottle with it. The vapour of the hydrocyanic acid, if present, will form a white precipitate, which may be tested. Other watch glasses treated with sulphide of ammonium or sulphate of iron and liquor potassii will give the reactions of the acid with appropriate test. This method removes all objection as to foreign admixture. If the acid is not at first detected, gentle warming of the bottle in a water bath will assist the evolution of the vapour. The vapour may be obtained by distillation, but this process is open to objections, to which the other is not. In some cases it becomes changed in the body into formic acid, which should therefore be sought for. Test: with nitrate of silver, a white precipitate, insoluble in cold but soluble in boiling nitric acid. The precipitate heated evolves cyanogen having an odour of peach blossoms, and burning when lighted with a pink flame. Liquor potassii and sulphate of iron give a brownish green precipitate, which turns to Prussian blue with hydrochloric acid. Liquor potassii and sulphate of copper gives a greenish-white precipitate, becoming white with hydrochloric acid. Sulphide of ammonium gives sulfocyanide of ammonium. This develops a blood-red colour with perchloride of iron, bleached by corrosive sublimate. End of section 17. Recording by Jeanie Whitfield.